Mental health challenges among children and teens have become a growing concern, but recognizing when a child is struggling and knowing when a situation has become a crisis can be difficult. We're joined now by Dr. Teresa Boykins. Welcome, doctor. Tell us some of the warning signs that a young person may be in crisis.
Some of the signs that we need to look for sure are sudden changes in mood, behavior, like withdrawing from family and friends, increased irritability, drastic changes in their sleep or eating habits, or decline in school performance. But we should never dismiss statements like hopelessness, feeling like they're a burden, or any talk about wanting to die, even if it's indirect or it may seem or appear as if it's a joke. We should always take those comments serious. And it's critical. Those are critical red flags that we should never dismiss and pay close attention to.
Don't just assume it's a joke or said in jest. Take it seriously every time.
Yes.
So if a parent, teacher, coach, friend, they believe a child is having a mental health emergency, what do they need to do in those first critical moments? And tell us what mistakes people typically make when trying to help.
We need to first listen, validate what they are saying, and not be dismissive. Don't make comments like, oh, your age group, they all think this way. There are many children that feel this way. We need to validate what they're saying. What they're saying may be real to them. And we need to make sure that we report it properly if need be, even if we have to contact 988, if it's an acute situation and we have to involve a higher level of crisis intervention. But most important, if you don't remember anything else I say this evening, validate what's being said and not be dismissive.
Yeah, that's such an important message. Thank you for that. Tell us about closing the gaps, because we're hearing about this concern nationwide, youth mental health. So what are we doing to add resources, to help families who may be struggling, get them the support? Is there an effort here in Oklahoma?
Yes, there is, and I'll be glad to speak to that. So we know that access to pediatric behavioral health has been a major gap, not just in Oklahoma, but nationwide. So OU Health, OU Children's, we are working to close that gap by building a more coordinated system of care that meets the kids and families where they are. So December 7th, we will open a 72-bed facility. It will be inpatient and outpatient, and it has 6 floors, and we will provide intensive outpatient, partial hospitalization, eating and feeding disorder programs, and then those beds that where they need a more longer stay, that a more acute stay on the inpatient side, not specific to residential, but a longer stay for more medication management. And that will open December 7th. And we are bringing in over 402 employees to make sure that we execute this and that we're able to provide those services, and that the care is not just here when they leave, that we make sure that they have those follow-up appointments. We've partnered with people in the community, Oklahoma City Police Department, to build those relationships, to get a better understanding and trust within the community. We've partnered with Brightway Counseling Center. We've partnered with DHS. We've partnered with ODMHSAS. We've built a lot of relationships to make sure that we have those resources and connections to where the system isn't just shut off or broken when they're discharged, but there is a continuity of care.
Yeah, looking at the whole picture, and something we really need. So happy to hear our community is getting that new facility at OU Children's. Thank you, Dr. Boykins.
Thank you.